Let's get going. And welcome to King County Recovery Conversations. So excited to be here. My name is Brad Finegood, and in my day job, I work for Public Health, Seattle, King County. But I'm here in my role as a board member with the King County Recovery Coalition and the Washington Recovery Alliance for today's King County Recovery Conversations. I can't even say how excited I am to be here with Lizzy DesChane. Did I pronounce that right?
Yes.
Okay. And Joe Barsana.
You got it.
Yes, I'm 2 for 2. That's a good start. From King County's Drug Court, staff with King County's Drug Court, with amazing stories and amazing conversations to have today. So without further ado, I'm going to let you all introduce yourself, and then we're going to get into conversation. So Lizzy, do you want to start off by introducing yourself?
Yeah. So I'm Lizzy DesChane. I am the treatment coordinator for King County's Adult Drug Diversion Court. I've been in that role for just over a year and a half now, but I've actually worked in drug court for 10 years. I've had 3 different roles within the program. I started out in 2014, right out of school as a resource specialist. I did that for about a year and a half. Then I moved into the treatment case manager role. Did that for about 8 years before stepping into the treatment coordinator role. Thank you so much for having us.
Oh, so excited. I also used to work in drug court programs. And so I worked for a long time in drug courts. And so when you were saying the extent of your time working in drug court, it just made me think back when I worked in drug courts and just thinking about how we did our time in drug court and the amount of time you put into working with people and seeing people through on the recovery journey. So thanks. And Joe, do you want to introduce yourself?
Absolutely. First off, shout out to the King County Recovery Coalition. Shout out to the Washington Recovery Alliance. I'm just fired up to be here. My name is Joe Barsana. I work at King County Drug Court. I've worked there just about 2 years now. I started as a resource specialist, but now work as the full-time housing case manager for drug court. I'm also the president and founder of the Washington State Therapeutic Court Alumni Association.
Nice.
And just recently, I'm serving on the board of the Washington Association Drug Court and the Washington State Association of Drug Court Professionals. That's a lot of things to say.
It's a lot. It's a lot of things to be involved in also.
But most importantly, I'm a proud King County Drug Court graduate. I graduated one time in 2011, and then the second time in 2020.
Snaps.
Absolutely. And I'm a proud person in long-term recovery from opiate use disorder, methamphetamine use disorder, benzodiazepine use disorder, and cocaine use disorder.
Man, what a journey. Yeah. What a journey that leads you here today. When I was walking in, I was talking with the studio person, and he was like, what amazing people to have. And my response was, there is nobody more grateful for experiences than people who are in recovery, and in that recovery journey. Awesome. Well, let's kick it off. I have so many questions. We're going to be here for hours upon hours. So we have so much time to talk. I'm just joking. For those of you listening at home, that's not the case. But there's so much to get to learn about drug court, to learn about your stories, to learn about the stories of recovery. Lizzy, do you want to start off maybe by telling a little bit about what drug court is, maybe what makes King County Drug Court special and different, all of that type of stuff?
Yeah, absolutely. So I just also first want to shout out May is Therapeutic Court Month. So that is very exciting. Adult drug courts in particular are really an alternative to incarceration that combine public health and public safety approaches to connect people involved in the justice system with evidence-based substance use disorder treatment. In King County in particular, I really see us as a collaboration between behavioral health and the justice system. We are really designed to support individuals with severe substance use disorders who also often have co-occurring mental health disorders, who are experiencing homelessness, unemployment, and also find themselves in the justice system. Most of our participants, it's not their first time in the system. I think our average participant comes in with at least 2 prior felony convictions. In King County, we are one of the oldest drug courts in the country. We are celebrating our 30th anniversary this year. There'll be a celebration, I think, in September, which we're excited about. We were the first therapeutic court in Washington State and the 12th adult drug court in the country, which is awesome. So we started in 1994. One of the things that's, I think, really special about our program is we are a pre-adjudication felony drug court. So we only take King County Felony Superior Court cases, and participants do not have to plead guilty in order to participate in our program. So whatever felony charge or charges that they have in drug court, they stay pending. And the big incentive behind participating in drug court beyond sort of, access to services and resources is that upon graduation, the charge or charges end up in a dismissal. Which not all drug courts are pre-adjudication.
Awesome. And I want to get back to some of the key components of drug court for those people who are listening and not on video. Lizzy's wearing an amazing shirt. I want to talk about that in a second too. But Joe, I want to get back to you for a second because you have such a unique experience as going through drug court multiple times, as you said, and now working in drug court. Maybe you can tell us a little bit about what it was like for you as a drug court participant, that trajectory, why drug court was so important, and the ability to maybe even have more than one chance and to be able to come back, if you don't mind sharing a little bit of your story.
Absolutely. I want to share my testimony about that. I mean, that's a really, really, really good question. When it comes to why I think drug courts were really successful for me, there's multiple different reasons that I think I was successful. But if I had to point to two main things, I think I would point to number one, drug court really allowed me to kind of explore all the different pathways towards recovery, right? Because we know not all, one size does not fit all, specifically with treatment. That's really important to know, right? So, throughout my years on the streets of, I was on the streets of Pack Highway, on the Blade, and through Aurora. Throughout those years, this last time, my substance use disorder was pretty severe. Right, it was pretty severe. I was coming in here. I was not on a winning streak, that's for sure, right? And I was kind of service resistant and all those things, So, and during that same time, right, I'm just cycled in and out of incarceration. That's just the cycle. There's a vicious cycle of being booked and released, booked and released, or booked and put on supervision, and I would not complete that supervision, right? And I would be booked, right? And I would lose it. So, I would always be released with no resources, no warm handoff, right? And I would end up in the same exact environment that I was in before, right back to Pack Highway. The difference is, well, what's the difference? Drug court, when they came into my life, right, it's a big difference, right? The second I was able to kind of get those resources that drug court offered, right, the intervention is so high, that's why I was successful, right? The second you're in drug court, I had the option to, housing. Is it outpatient treatment? Maybe it's inpatient treatment. Maybe it's long-term inpatient treatment. Is it medicaid-assisted treatment, which is a big deal, right? Is it mental health services, right? So that's a big point of why I think I was successful, right? And kind of as a participant is that I had to attempt many different ways for recovery. I messed up many times early on in my drug court journey, right? And drug court was really patient with me. They worked with me, right? They didn't throw me in jail because I relapsed. They didn't throw me in jail because this type of treatment I wasn't successful at, right? They worked with me to kind of find a solution, really, and that's how it has. So, what I will say is I filtered through in and out of this system for quite a bit of time, right? Just on the streets, back in custody, on the streets, and me being in drug court twice, like I mentioned before, is that the terrible thing about completing drug court the first time is that when you get loaded the second time, that most likely the thing that's going to help you be successful is going back to drug court, right? And, so thankfully.
Because that there's an intervention out there that's really worked for you that you had to go back to about those relationships, about those connections, and about those supports that were available to you.
Absolutely. That was the biggest factor, right? Is that I knew that the support systems that I gave, it's a really big deal. All those different things are really important. I would definitely, the second thing I would point to too, I think that drug court really offers, that's really amazing about drug court, is this accountability model. I call it the empowerment model, right? I really call it an empowerment model. And what I mean by that is I had a group of people like Tom Essex, and I had a judge, right, who kind of really allowed me to explore my full potential, right? They held me accountable. They said, Joe, you can be better than what you're doing.
Yeah.
you can do better,
Yeah.
right? And they held me accountable, and through that model, I started to develop recovery systems, right? Recovery support systems, all those different things. And they often say the opposite of addiction is connection.
Yeah.
Drug court got me, and they
Yeah.
connected me with those people,
Yeah.
right? They really connected me with the folks that allow me to be successful and kind of explore myself.
Yeah.
So, the journey, it's interesting. It's a lot of work.
Yeah.
But I've never felt better in my life than I do today.
Yeah.
So I'm just grateful for drug court.
Awesome. Well, I'm grateful for drug court that you're here with us today too. And, mentioning Tom Essex, who was one of, I think was your predecessor,
Yes.
right, Lizzy?
Yep.
The thing about Tom Essex that I have issue with is he's a Steelers fan.
That's right.
And, but the Steelers I'll take as my second favorite team. So if Tom's out there listening, there is hope
That's
for
terrible.
you.
Go Hawks.
Yeah. There's love in the room. So Lizzy, can I describe the shirt you're wearing? Or do you
Sure.
want it?
Yeah.
So Lizzy's wearing a shirt, for those of you who can see it on video, that says methadone saves lives. And I love that shirt. And if we're in the mood for shout outs, Dr. Kaylin Folkley, who's been putting out some buprenorphine saves lives, methadone saves lives, naltrexone is harm reduction shirts, to be able to promote evidence-based practices in the community. So one of the things when I first came to King County, and before this when I was in Clark County and I ran their drug court, is the acceptance of medications and pharmacological interventions and evidence-based treatment in drug courts, because for a long time that was not accepted, right? And the guiding saint of all drug courts in Washington State, Mary Taylor, was one of the first people to ever introduce me to this concept within the drug court model. So can you talk a little bit, and King County was one of the first in the country to allow people on medications and evidence-based treatments to be part of their recovery journey. Can you talk a little bit about the role of medication and just some of the how those policies are developed and how that works within King County Drug Court, and anything else around evidence-based practices that are included?
Yeah, absolutely. Just kind of start off, drug courts themselves are evidence-based when done correctly. I think, the Washington State Institute for Public Policy recognizes drug courts as an evidence-based program. There's sort of a very large national organization called All Rise, which has done, 30 years of research on drug courts, and there are best practices. And I think in King County, I've been there for 10 years in our drug court, and I can say confidently that we have always been in line with those best practices and really sort of been at the forefront too of figuring out how to implement them into a drug court. And I think our sort of allowance and support and encouragement of Matt is a great example of that. I was actually Christina Mason, who is our current program manager following Mary Taylor. I was asking her about this, because as long as I've been in drug court, like Matt's just been a thing. Like we have it, we encourage it. We have a lot of conversations about the stigma around it with participants when they come in, because we know that it's evidence-based and a lot of people benefit and find their recovery using that medication. And I will say, especially, the last few years with the rise of fentanyl in our community, I think it's become even more important. Sort of my observation, it's been very hard for people to stabilize in the community without medication-assisted treatment on board. I am, grateful that we have so many resources in the community to be able to quickly connect people to that medication. That's super important. The Butte hotline that just started, 24/7, that is amazing, because you have to have a way to quickly connect. I think that is key. But yeah, so King County Drug Court, Matt's just been a part of us. We encourage it. We support it. Like I said, we have a lot of conversations with participants around it. We use a lot of other evidence-based treatment interventions in our program.
Like what, Lizzy? What else have you seen that's really worked for people?
Yeah. I think, Joe kind of talked about it. the fact that we have access to so many different kinds of treatment modalities, and we understand that every participant comes to us. Yes, they're all a King County Drug Court participant, but they're all coming in with their own unique set of needs and barriers, and what's going to work for one person isn't going to work for the other. So we utilize outpatient treatment. We utilize inpatient treatment when that's clinically indicated. We use the shorter term 28 days all the way up to long-term, 9-month long programs, mental health services, psych medications, MAT, connecting people to recovery supports in the community. Peer support is a big one that we have really the last few years really worked towards creating a really robust peer support program. We actually am really proud. We now have 3 full-time peer support specialists that work just with our King County Drug Court program. And all 3 of them are King County Drug Court grads.
That's so great.
They're supervisors at King County Drug Court grad. They're on site with us in our office in the courthouse up on the 9th floor. Every single court calendar that they have, they're sitting in the courtroom, connecting with participants, offering support. We also, at the end of the day, we are a behavior modification program. So, like Joe said, the drug court can be a lot of work. We have a lot of monitoring, we have an accountability component. What we use to support that behavior change, that's evidence-based, is contingency management. So we really...
What is contingency management?
Yeah, so it's just a behavior modification strategy that utilizes incentives to, reward the behaviors that we want people to engage in. So we've offered incentives literally for showing up to orientation on day 1. You get a gift card.
Yeah.
Staying to complete the paperwork with your case manager, you get a gift card.
Yeah.
Going to your first sober support meeting, gift card, just simple showing up. And then treatment also gives out incentives on site when people meet their treatment milestones. When someone comes to court and they're in full compliance, they get to spin this sort of, it's like Wheel of Fortune. they spin a wheel and can get a prize, that way. Everyone claps for them in the courtroom. A lot of verbal praise you'll hear coming from every member of the team. And then on the flip side, right, we do address non-compliance with sanctions. I think sort of a big, misconception about drug courts out there is sanction equals jail. Yeah. Right? You miss a group, you go to jail. You have a return to use, you go to jail. We hardly ever use jail in our program. For us, sanctions look like, figuring out why did this behavior occur? Sure. And also keeping in mind, where's that person at in the program, in the recovery? Are they just starting?
Support the recovery,
right? Are they
structure?
Are they just starting out with us, or are they in our final phase and have been here for 9 months? Right. So our response is going to look different for those 2 people. So we utilize writing assignments. Maybe it's extra check-ins with your case manager. Maybe it's coming to court more frequently.
A little bit more love.
Yeah, just more support.
Yeah. Cool. Yeah. When people question the idea of positive reinforcement or incentives or contingency management, I think about my personal experiences in life, right? Like, I know where the meetings or to go to or whatever that provide the food that I like. Totally. Or I think about right now with one of my kiddos at home trying to get some chores done, and at the end of this journey of doing chores, there might be something positive for them, right? Versus that stick. And so it's just human behavior, right?
It is.
So absolutely. So one of the things you mentioned is the role of recovery and supports and connection and peers. Joe, maybe you can talk a little bit about, your not only your life experience, but what that has been like providing, guidance and connection with people going through drug court as somebody with the lived experience that you bring to the table.
Absolutely. what I think the most important thing is that connection, right? I think trust is a big deal for a lot of folks coming into the court. I know in this system,
Yeah.
coming into this system, you don't trust the criminal justice system. You
Yeah.
don't trust the judges, the state, right?
Yeah.
So when you come in and you have someone on your level and said, hey, I graduated this program. Hey, I've been system involved for a very long time. Or you get the peers that we have over there that kind of get to them and kind of speak to them on a certain level, right? Us in recovery, we speak a type of language, right? And I think that just really gives them the ultimate amount of support and courage to continue to do the program, right? At the same thing, right? When we hold people accountable, I call it empowerment, right? Because, they know that, hey, I was in your shoes before.
Yeah.
I've done this before. I've messed up before.
Yeah.
But you can be anything you want to do. Your potential is endless,
Yeah.
right? Thinking coming from someone who has a criminal history like me, someone who's made so many mistakes like me, right? And that they can turn their life around too. It's lived experience.
Yeah.
The strength of lived experience is
Yeah.
such an important thing, right? And lived experiences in everyday life, people have lived experience, but the power of recovering and recovery, it just shines, right?
Yeah.
I think it's really a connection that folks, when they know I went through the program, right? Kind of like one of my predecessors, Joe Conniff, I have my booking picture, right? So I have a booking picture of before and after. I have about actually 8 booking pictures, right? Of when I was coming into drug court and then my 5-year anniversary, right? When they see that, they make a connection, right? Because it's hard to explain to a case manager what it's like to wake up dope sick in jail.
Yeah,
it's hard to
absolutely.
explain what it's like having been on warrant, having to look over your shoulders and run from the cops all the time, right? That's something that's really hard to connect with. When you find your people, right, that's that connection.
They know.
They know.
You know.
They know that. They speak
Yeah.
that language,
Yeah.
right? So you make that connection, and it's critical because we're asking our participants to leave everything they know.
Yeah.
Right? I still have people on there who are on the streets that I absolutely love, right? I still reach out to them. I offer them support, right? And they still mean a lot to me. We're asking our participants to give all of that up.
Yeah.
Right? If you're giving all that up, you got to replace it with something.
Yeah.
There needs to be a recovery support system, right?
Yeah.
And a lot of times, they see the peers really empower each other. A lot of times they go to groups together, they live in the same housing together, all those different things. And you just see this type of empowerment kind of being created throughout camaraderie of people kind of saying, hey, I love it. We often will see, people who show up to court. It's not their court date. Why are you here? Oh, I'm here for my friend. He's my roommate. Right?
Yeah.
I'm here for this person.
Yeah.
I'm here to support them. Or, hey, this person's going through a rough time. I'm going to show up for them and show up and be there for them, right? And that connection you can't measure it. There's no type of data that really measures that type of connection.
Yeah, absolutely. Quick question for you, Joe. So when I ran drug court, we started an alumni program. And one of the things that happened in the alumni program is some of our alumni were there either providing support, peer support, or as alumni. And people came into drug court that they used to use with, out on the street. And that was one of the most powerful moments for me, is somebody coming in, seeing somebody that their association with used to be around using drugs, and now presented an idea of what life could be like for them. And I don't know, did that experience ever happen with you?
Absolutely. I think it's funny. My coworkers, when they see like an arrest at a certain address, they're
Yeah.
like, do you know this person?
Yeah.
They got arrested on Pack
Yeah.
Highway South. Right. I had my stomping grounds. And of course, there are a lot of people in the program that I know. Right.
Yeah.
And when they see me, right, a lot of the times they get, they get knocked off to it because they say, oh, my nickname's River out in the streets. And they don't know who River is. Right. But you hear that. People,
Yeah.
and when they see me, they just kind of, they get extremely happy. And they just I think there's an empowering feeling when they see someone that they knew that used to run with them.
Yeah.
That used to overdose out in
Yeah.
the woods with them. All those bad things
Yeah.
that I can pick myself up. And legitimately, we know that they can pick themselves up too.
Yeah. It's interesting. I think about my own personal experience. I have a brother that died of a drug overdose, and that has really molded how I see the work and the work that I do. But my own personally, like right now, I haven't drank for going on 4 months now, right? And although I'm not in recovery, it's not around recovery, it's just around, personal choices, whatever. Everybody has their own trajectory. Yeah. When I tell friends that I used to drink with, they're so happy for me, right? And it occurs to me when you were talking that people who are often using are so happy for other folks when they can, when they can find a life that's working for them and move along on the recovery journey. Awesome. One of the questions that often comes up when we talk about drug courts and we talk about drug courts in the community, there's often people who are detractors of drug court, right? And are not supporters because of the criminal legal system sort of leverage. What are your thoughts on that? What do each of you have to say? One of the things that I know is that I'm really proud of the work that King County Drug Court does, because making a shift from some of the things you were talking about, Lizzy, about not using jail as sanctioned, except, maybe as tail end, taking people in multiple times if they need that unconditional, positive regard. And really not, you were talking earlier, Lizzy, about sort of not cherry picking clients, not taking easy people who you think are going to succeed. So, I mean, those are some of the reasons that I'm really proud of the work that's been done here in the county and provided that journey for folks. But maybe you all can talk a little bit about when there are people who question the efficacy of drug court or detract around drug court.
Yeah, absolutely. When it comes to that, someone with significant lived experience in the carceral system, inside of this criminal justice system, it's easy to understand the criticism, right? It absolutely is. I think a lot of it, though, is based off of kind of being misguided or kind of a little bit of misinformation. I think there's this archaic thought out there that drug courts, they grab people, force them into treatment. If you don't go to treatment, you send them to jail. If you don't be successful at this type of treatment, you go right to jail, right? Yeah. You don't collect dough, you go right to jail. That's an archaic thought that's really out there. And, and I even thought that in the system, right? And there's always that thought, drug court's tough. It's just don't get set up for failure, right? But being a drug court participant, it all disappeared. And working in drug court, the reason I would definitely point out is that, just because you call yourself a therapeutic court or a drug court doesn't mean you're a therapeutic court or a drug court, right? Because therapeutic courts require you to utilize the decades of best practices, decades of evidence-based interventions, therapeutic adjustments, trauma-informed practices, right? That's absolutely what therapeutic courts do. Therapeutic courts continually monitor the programs for any inequities and then work as a team together to address those inequities, Love right? It. That's what King County Drug Court's about, right? Yeah. Our position is that we get people out of jail and we keep them out of jail, right? That's the whole point of King County Drug Court. That's the point of how I look at my position, right? I get someone out of custody and I keep them out of custody, right? And I think a lot of it too is, a lot of times in the public discourse, you hear, there's us versus them or this side or that side, right? I would definitely say in my feelings is that I think everybody has an important role in this King County community, right? Yeah. Everyone has such a critical role. Drug court has its important role. Public health has a huge role. Behavioral health has a huge role. Harm reduction has a huge role in this community, right? Reentry, whatever it may be, everyone has a specific role. Yeah. And I think it's really important that we kind of know that we're all working towards the same goal.
Yeah, absolutely. Well said. It's really in that continuum. Lizzy, what are your thoughts?
Yeah, I think there's a lot of misconceptions out there about drug court for sure. And, I think I sort of alluded to this earlier. Not all drug courts are created equal. Joe touched on it too, right? Just because you sort of call yourself a therapeutic court doesn't mean that you are one. And I would say, in King County, like I've said, we do work really hard to ensure that our program is in line with the best practice standards. We are constantly looking at our outcomes, as often as every month, and looking at our graduation rates and who's graduating and at what rate they're graduating and where can we do better and who can we serve better and how are we going to figure this out to make sure that our court is equitable. And I like Joe said, I mean, we don't want people in the system either because they have a substance use disorder, right? But unfortunately, people are. And I think the fact that drug court serves as sort of one of the last off-ramps before someone is headed to serious incarceration is great. And I think we do a really good job at serving those people.
Yeah.
And we do that by not just, providing treatment and resources to get them to graduation, but our program's also really designed to make sure that people have those supports in place, graduation and beyond, so that they're staying out
That recovery,
of the
right?
system. Yes. Yeah. So, in our final phase of the program, for example, someone's treatment requirements are probably very minimal because they've sort of gone through outpatient treatment. Maybe they're doing monthly individual sessions. We are encouraging them to go to sober support meetings, but they're not necessarily required. But we're really wanting them to be engaged in that positive pro-social activity, figuring out how they're going to support themselves after drug court.
Yeah.
Can I jump in real quick?
Yeah.
I also think that's a great thing that she absolutely said. But, I think the reality, right, of it is that someone like myself with a significant and severe substance use disorder, right, are going to commit crimes that are going to be prosecuted as serious felonies, right? And I think it's just important that we have an off-ramp, right? Of course, community-based resources are so important.
Yeah.
To have that pre-arrest intervention, all those things are important. The reality is that people who, and my peers and myself, right, we commit significant crimes, and there needs
And that's
to be,
not everybody.
That's not everybody,
Right.
right? But there's some that's important that we have an off ramp, right? Because the other side of the coin is mass incarceration,
Yeah.
right?
There's got to be off ramps at every point, right?
Absolutely.
Yeah.
And I would say too to the detractors, there's I'm mentioning my Washington State alumni group, right?
Yeah.
So I meet with alumni from out in the desert and rural areas,
Yeah.
on the coast, in the big cities, right? What do we all have in common, right? A lot of things we had in common is we became successful through this accountability model of drug court, right?
Yeah.
And there's just thousands of people in the community that have found success. Fortunately, unfortunately, incarceration becomes a part of a lot of people's story in recovery. That's just what it is, right?
Yeah. It's interesting. I spent a lot of my career early on working in prisons and jails. And one of the things that really occurred to me is that because of this war on drugs mentality, right? And one of the things that occurred to me is that people don't really find recovery in jails and prisons. It's not a rehabilitative place. So when you were saying, Joe, we do everything to connect people in community, keep people out of jail, it's, because people need to recover in the community,
Absolutely.
right? People always need to come back. We have only a couple minutes left. Like I said, I would have rather this conversation go on for hours.
Me too.
Unfortunately, fortunately for us, we get to also work together, and this can go on for years. So I feel really fortunate. But for this conversation, we only have a couple minutes left. So maybe I can give each of you one last opportunity. If there's anything that you want to share with with the recovery community, with the community at large, about the role of recovery, how drug court plays a role, any other lasting thoughts you have. This is not the last time you can share your thoughts forever, but for this podcast episode, anything else that you would like to share? I'll flip a coin to see who goes first.
We were supposed to call it.
Heads.
I guess your
tails.
tails. It landed right on the middle. So I'll let you guys. So Joe, do you want to kick it off?
Absolutely. What I would definitely end with is, we can and do recover.
Yeah.
Right. I'm someone that
man.
often woke up with police officers standing above me.
Yeah.
Because I overdosed in a dirty hotel floor.
Yeah.
Or on the bottom of a tent floor.
Yeah.
Right. I'm the person that police officers said, hey, I'm not going to take you to jail, but do me a favor, never come back to this town again. Right.
Yeah.
I was that person that the community gave up on.
Yeah.
Right. I victimized this community. I committed crimes. One judge said you're a one-man crime wave. Right. And that type of disunity and disconnection, right, it's hard to come back from. But if you give these really thoughtful and careful and loving interventions to people, we do and can recover, right?
Dude.
And that there's just so much amazing lived experience out there, and so much, the human spirit endures through a lot of folks in recovery, because we've seen the darkness and we drug ourselves back to the light. So I think that's important.
So good.
Yeah.
Thank you. Lizzy?
Yeah, I just sort of want to reiterate, there's no one solution that's going to address substance use disorder in our community. And I feel really fortunate to be in an area where there's a lot of resources and programs out there to help people recover. And I think we're all part of the solution.
Yeah. So good. You know, in our run up to this and conversations we've had, we've talked about so many other things, about the role of harm reduction in drug court, about the role, we talked a lot about peer support today, about the vast array of resources that are available in the community that you work with, and so much good work. I can't even begin to tell you, like, this conversation was so good. I'm afraid they're going to want us back for round 2. But if that's the problem, those are good problems to have. And just for everybody who's listened today, just a big thanks, and a big thanks to the Washington Recovery Alliance, the King County Recovery Coalition, and all the people who work to make this podcast available and for everybody out there in the community. So on behalf of Lizzy DesChane, on behalf of Joe Barsana, my name is Brad Finegood, and thank you for listening to King County Recovery Conversations.